we're treating some of the hypertonic multifidi in Leona here. I'm deforming the muscles with my left hand to sort of shift the muscles into a little bit of a stretch, and then my thumb is applying sort of the therapeutic force, if you will. This is often how we identify things. It's just by running our thumb along that groove next to the spinous processes. And as we do, we find there's all sorts of places. So just in the lower thoracic region here, I've got my first hypertonic multifidi fibers. So I'm just doing a static compression on them, and I'm just sinking in to the point at which the muscle resists my compressive force. You notice how Leona's breathing nice and fully and easily. And what you'll often find is that after 3 or 4 breaths like this, you'll find the tone of the multifidi starts falling. As it does that, then I'll often strip along the fibers. So before I was stripping along the spinous processes, when I got inhibition of some taut fibers, now I'm stripping along the length of those fibers to consolidate the dropping in tone with actually a little bit of lengthening of that myofascia. Sometimes if the fibers are a little bit stubborn, I might go at right angles to them and introduce a transverse directed force, which I think causes the muscle to sort of reevaluate the tone. So the length receptors and tension receptors associated with the muscle have new information. And this has actually been more helpful this time than that just static compression. So I've had a nice drop in tone of some fibers, and now I'm consolidating that by bowing the fibers even further. I've had a couple of releases, I get a third, and then again, strip away and get some sweet length in that muscle. So proceeding inferiorly. As we know from earlier, there's this patch here where the multifidi are very stubborn. You can just introduce some alternate thumb kneading if you like, just to increase the pliability of the tissue, get some mechanical force in there so the connective tissue starts to become a little bit more fluid. And this is an old injury site, so you can actually feel some taut bands coming off there. So I'm going to just hook into those and do one of my little transverse challenges, transverse to the fiber direction. And as that gives, I'm just spreading it relative to some other fibers in there. So just do a nice workman-like job, cleaning off the attachments at the spine, and then following a nice sort of inquisitive workman-like fashion along the fibers and right down to where they hook in just below each facet joint. So these fibers for sure are going to be influencing the mechanics of Leona's lumbar spine, making this segment kind of stiff and not as able to flex as she flexes forward. And of course that's going to make more stress above and below, and more problems can arise from that.